Your doctor looked at your swollen legs and told you it was circulation, maybe poor blood flow, maybe your heart working too hard, maybe just aging, and you accepted that explanation because it came from a doctor. You went home with compression stockings and a diuretic and instructions to elevate your legs in the evening, and it helped. A little, temporarily. But the swelling came back. It always came back. And at your next appointment, your doctor looked at your ankles again and adjusted the dosage and said these things take time and moved on to the next patient. What if that explanation was incomplete? What if your legs are not the problem at all? What if your legs are the alarm? And the fire is somewhere else entirely, somewhere your doctor never checked, somewhere most doctors are trained to overlook when they see a senior walk in with swollen ankles and a history of heart issues and poor circulation. Your brain? The same organ responsible for regulating fluid retention, vascular tone, inflammatory response, and nerve signaling to every blood vessel in your lower body. The organ that when it begins to deteriorate after 60 sends your legs into a state of chronic dysfunction that no compression stocking and no diuretic will ever fully resolve. Because they are treating the alarm, not the fire. Today, I am going to show you exactly how your brain controls what happens in your legs, why that connection breaks down after 60, what your doctor is missing every single time they look down and not up, and what you can do about the brain side of this problem that nobody has ever told you to address. My name is Dr. Angela Whitfield. This channel exists to show you what a rushed 15-minute appointment never will. Before we begin, everything I share here is for educational purposes only. It is not a substitute for professional medical advice. Please speak to your doctor before making any changes to your health routine. And drop your city or country in the comments right now. I want to know who is watching this today. I read every single one, and I genuinely mean that. Before I take you through the brain mechanisms behind your swollen legs, I need to give you one concept that changes how you see every symptom in your body from this point forward. I call it the brain first principle. Here is what it means. Your brain is not just your thinking organ. It is your body's master control system. Every organ, every blood vessel, every nerve, every inflammatory process in your entire body operates under direct or indirect instruction from your brain. When your brain is healthy, those instructions are precise, coordinated, and protective. Your kidneys know exactly how much fluid to retain. Your blood vessels know exactly how much to dilate or constrict. Your immune system knows exactly when to activate and when to stand down. When your brain begins to deteriorate after 60, those instructions become corrupted. Signals arrive late. Some do not arrive at all. Others fire when they should not. And the result is not a brain symptom that shows up on a memory test or a cognitive assessment. The result is a body symptom: swollen legs, high blood pressure, failing kidneys, irregular heartbeat, chronic pain. Your doctor sees the body symptom and treats the body, gives you a pill for the legs, a stent for the heart, a blood pressure medication for the vessels. But the corrupted instruction came from above, from the brain. That is the brain first principle. And once you understand it, you will never look at a diagnosis the same way again. Keep it in mind as we go through everything I am about to show you. Let me tell you about Evelyn. Evelyn was 73 years old, a retired school teacher from Savannah, Georgia. Warm woman, still sharp in conversation, still active in her church community, still driving herself to appointments and grocery shopping and managing her own home. She had been dealing with swollen ankles for 4 years, not mildly swollen, noticeably, painfully swollen. By the end of every day, her ankles were so puffy she could press her thumb into the skin and leave a visible indent that took 20 seconds to spring back. She had been through the standard workup: cardiac ultrasound, kidney function tests, Doppler ultrasound of her leg veins for blood clots. Her cardiologist had noted mild diastolic dysfunction, which is a common and somewhat vague finding in older adults, and attributed the edema to that. Her primary care doctor agreed. She was given a low-dose diuretic furosemide, 20 milligrams daily. She was given compression stockings rated at 20 to 30 millimeters of mercury. She was told to elevate her legs whenever she sat down, and her doctors were satisfied with this management plan. Evelyn was not satisfied, because the swelling never fully resolved, because she had to plan her entire day around whether she had taken her diuretic early enough, because the dizziness the diuretic caused when she stood up had already made her stumble twice, once in her bathroom and once in her kitchen, and she had not told her doctor about either incident, because she did not want them to worry, and because over the same 4 years that her ankles had been swelling, she had noticed other things she had not connected to her legs because nobody had suggested they were connected, a creeping fogginess in her thinking that she had attributed to aging, a frustrating difficulty finding words mid-sentence that she had started masking in conversations by rephrasing around the words she could not reach. Sleep that had become fragmented and unrefreshing, waking between 2 and 4 in the morning and lying awake for an hour or more before drifting off again. And a short-temperedness with her grandchildren that her daughter had gently mentioned once, and that Evelyn had dismissed as tiredness. 4 years, 4 symptoms, 4 separate explanations from 4 separate appointments, and not a single doctor who had ever asked whether they might all be pointing at the same place. Here is what the research shows about the brain and swollen legs that most clinical training does not connect in the way it should. There are 4 specific mechanisms through which your brain directly controls what happens to fluid in your legs. Understanding these 4 mechanisms is what separates a complete explanation of edema in an older adult from an incomplete one. Mechanism number 1. Hypothalamic control of fluid retention. Your hypothalamus is a small but extraordinarily powerful structure at the base of your brain. Among its many regulatory functions, it controls the release of antidiuretic hormone, also called vasopressin, from the posterior pituitary gland. Antidiuretic hormone tells your kidneys how much water to retain in the body and how much to excrete in urine. When your hypothalamus is functioning correctly, this regulation is precise and responsive. Your fluid balance is maintained within a narrow, healthy range. When the hypothalamus is affected by neuroinflammation, by the early structural changes associated with cognitive deterioration, or by the chronic sleep disruption that accelerates brain aging in older adults, this hormonal signaling becomes erratic. The kidneys receive inconsistent instructions. On some days, they are told to retain far more fluid than the body needs. That excess fluid has to go somewhere, and it goes to the lowest point of your body, your ankles, your lower legs. This is not a kidney problem. This is not a heart problem. This is a corrupted instruction from the brain reaching the kidney and the kidney doing exactly what it was told to do. A 2020 study published in the journal Neuroendocrinology found that hypothalamic dysfunction in adults over 65 was significantly associated with dysregulated antidiuretic hormone secretion and downstream fluid retention patterns that mimicked the presentation of cardiac and renal edema in clinical settings. Mimicked, meaning doctors looked at the fluid and thought heart or kidney when the source was hypothalamus, when the source was brain. Mechanism number 2. Autonomic nervous system dysregulation and vascular tone failure. Your brain controls the diameter of every blood vessel in your body through the autonomic nervous system, specifically through the sympathetic and parasympathetic branches that maintain a constant dynamic balance, determining whether your vessels constrict or dilate in response to changing demands. In a healthy brain, this system is precise. Blood vessels in your lower extremities maintain enough tone to prevent blood from pooling. The venous pump that drives blood back up from your legs toward your heart receives consistent autonomic support. When the autonomic regulatory centers in your brain deteriorate, this precision is lost. The sympathetic signals that maintain vascular tone in your lower legs arrive late or at the wrong intensity. Blood vessels dilate inappropriately and lose their ability to maintain adequate pressure. Blood pools in the veins of your lower legs. Hydrostatic pressure builds inside the capillaries. When capillary pressure exceeds the osmotic pressure keeping fluid inside the vessel, fluid leaks out into the surrounding tissue. That is edema. Your doctor calls it venous insufficiency. And venous insufficiency is an accurate description of what is happening in the leg. What it does not describe is why the insufficiency developed. The autonomic dysregulation that created it came from above, from a brain whose regulatory capacity is diminishing. A 2019 study in autonomic neuroscience found that older adults with measurable cognitive decline showed significantly impaired lower limb autonomic vasoregulation compared to cognitively intact peers of the same age, and that the degree of vasoregulation impairment correlated directly with the severity of cognitive change. The worse the brain, the worse the vascular tone in the legs. That is not a coincidence. That is a mechanism. Mechanism number 3. Neuroinflammation and capillary permeability. Chronic low-grade inflammation in the brain does not stay in the brain. When microglia, the brain's resident immune cells, become chronically activated, they release inflammatory signaling molecules called cytokines into the systemic circulation. These cytokines travel through the bloodstream to every tissue in the body, including the walls of the tiny capillaries in your lower legs. Inflammatory cytokines, particularly interleukin-6 and tumor necrosis factor alpha, directly increase the permeability of capillary walls. They loosen the tight junctions between capillary endothelial cells. They make the capillary wall leaky, and when capillary walls are leaky, fluid seeps out of them into surrounding tissue at a rate the lymphatic system cannot clear fast enough. You get edema, and your doctor prescribes a diuretic that forces the kidney to dump fluid into the urine. The swelling reduces, but the inflammatory signal is still circulating. The capillary walls are still permeable. Within days or weeks, the fluid leaks back in and the swelling returns. You increase the diuretic dose, and the cycle continues. A 2021 study published in the Journal of Neuroinflammation found that systemic edema in older adults was significantly associated with elevated neuroinflammatory markers, including interleukin-6 and tumor necrosis factor alpha. The researchers specifically noted that peripheral edema in otherwise unexplained cases in older adults warrants neurological investigation that current standard clinical protocols do not routinely include. Warrants neurological investigation. That phrase in a published research paper means the scientific community is aware that the brain is being missed, and it is still being missed every day in appointments just like yours. Mechanism number 4, sleep disruption and lymphatic failure. This is the mechanism that surprises people the most when they understand how directly it connects. Your lymphatic system is the secondary drainage network responsible for clearing excess fluid from tissues throughout your body. It runs parallel to your circulatory system, but it does not have a pump the way your heart pumps blood. The lymphatic system relies on muscle movement, breathing, and the rhythmic contractions of lymphatic vessels to move fluid upward through the body and return it to circulation. During deep slow-wave sleep, the lymphatic system operates at its highest efficiency. The muscle relaxation and rhythmic breathing of deep sleep create optimal conditions for lymphatic drainage. Simultaneously, the brain's own glymphatic system, the waste clearance network that runs only during deep sleep, clears the inflammatory proteins and cellular debris that would otherwise accumulate in brain tissue overnight. These two systems are running together, clearing the brain and clearing the body simultaneously during the hours of deep sleep. When sleep is fragmented, when deep slow-wave sleep is disrupted or absent, as it so commonly is in adults over 60, both systems underperform. The lymphatic system does not complete its overnight drainage cycle. Fluid that should have been cleared from leg tissue during the night is still sitting there when you wake up. Your legs are already slightly more swollen in the morning than they should be. By evening, after gravity has worked on them all day, the accumulation is significant. You tell your doctor your legs are worse in the evenings. Your doctor nods and says that is normal with this kind of circulation problem. But the starting point was the night before, and the night before started in the brain. Type yes in the comments right now if your doctor has never once mentioned your brain in connection with your swollen legs. I read every single one. Now here is what you can actually do about the brain side of this problem. Because understanding the mechanism is only valuable if it changes something you do. There are 5 specific interventions that address what is happening in the brain rather than just managing what is happening in the leg. These are not replacements for your current treatment. They are additions that work at the level your current treatment is not reaching. Intervention 1. Make deep sleep a non-negotiable medical priority. Not a lifestyle preference, a medical intervention for your legs. Every night of quality deep sleep gives your lymphatic system a full, uninterrupted shift to clear the fluid your body accumulated during the day. It simultaneously reduces the systemic inflammatory load that is making your capillaries leaky. And it supports the glymphatic clearance that removes the brain proteins driving neuroinflammation. 7 to 8 hours minimum. The same consistent sleep and wake time every day, including weekends, because your brain's circadian rhythm governs the timing of both glymphatic and lymphatic activity. Bedroom temperature between 60 and 67 degrees Fahrenheit, because core body temperature drop is one of the primary triggers for slow-wave sleep initiation. No screens for 1 hour before bed, because blue light suppresses melatonin and delays the brain's transition to deep sleep stages. No alcohol within 3 hours of bedtime, and this is critical because alcohol is one of the most effective suppressors of slow-wave sleep that exists. It may help you fall asleep, but it fragments the deep sleep your lymphatic system depends on. Every night you protect your sleep, you are treating your legs from the inside in a way your compression stocking cannot reach. Intervention 2. Reduce your neuroinflammatory load through specific dietary choices. The dietary drivers of chronic neuroinflammation that is making your capillaries permeable are well established and specific. Ultra-processed foods. Refined vegetable oils high in omega-6 fatty acids, particularly soybean oil, corn oil, and sunflower oil that dominate processed food manufacturing. Refined sugar and refined carbohydrates that spike blood glucose and trigger inflammatory cascades. Excess sodium that increases fluid retention through mechanisms entirely separate from the neuroinflammatory pathway. The dietary reducers are equally specific. Fatty fish, salmon, sardines, mackerel, 2 to 3 times per week, providing EPA and DHA omega-3 fatty acids that directly suppress neuroinflammatory cytokine production. Extra virgin olive oil as your primary cooking fat, providing oleocanthal, a natural compound with anti-inflammatory properties comparable in mechanism to ibuprofen without the cardiovascular risks that make ibuprofen dangerous in seniors. Leafy green vegetables daily, providing folate and vitamin K that support vascular wall integrity. Blueberries and other deeply colored berries, providing anthocyanins that cross the blood-brain barrier and reduce microglial activation. Turmeric with black pepper, because piperine in black pepper increases curcumin absorption by up to 2,000%. These are not general healthy eating suggestions. These are specific interventions targeting the neuroinflammatory mechanism that is driving fluid out of your capillaries and into your leg tissue. Intervention 3. 30 minutes of moderate aerobic exercise 5 days per week, not primarily for leg circulation, for the brain that regulates leg circulation. The evidence for aerobic exercise as a neuroprotective intervention is stronger than the evidence for any supplement or any single dietary change currently studied. Walking for 30 minutes 5 days per week has been shown in multiple independent studies to reduce circulating inflammatory cytokines, improve autonomic nervous system function and vascular tone regulation, support hypothalamic hormonal regulation, stimulate the production of brain-derived neurotrophic factor, which promotes the growth and maintenance of neural connections in the regulatory centers that control your vascular system, and improve deep sleep quality, which we have already established directly supports lymphatic drainage. Every single one of those effects addresses a mechanism driving your swollen legs. Walking is not just good for you in a general sense. Walking is a direct pharmacological intervention for the brain-leg connection that your prescription diuretic does not touch. Intervention 4. Have a different kind of conversation at your next appointment. Not a conversation about your legs, a conversation about your brain. Go in with specific questions. Ask whether a cognitive baseline assessment has ever been included in your workup for the edema. Ask whether your inflammatory markers, specifically interleukin-6 and C-reactive protein, have ever been measured alongside your standard cardiac and renal panels. Ask whether your current medications have any known effects on autonomic nervous system function or on sleep architecture, because both directly affect fluid regulation. Ask whether your sleep quality has ever been formally evaluated in the context of your edema. These are not questions that challenge your doctor's competence. They are questions that expand the frame of the investigation, and any physician who is genuinely oriented towards solving your problem rather than managing your symptoms will welcome them. Intervention 5. Track everything together for 30 days and bring the data. Start a daily log. Every evening, note your swelling level on a scale of 1 to 10. Note how you slept the night before. Note what you ate the previous day. Note your stress level. Note whether you experienced any cognitive symptoms that day: brain fog, word retrieval difficulty, disorientation, mood change. After 30 days, look at the patterns. You will almost certainly see that your worst swelling days follow your worst sleep nights, that your best swelling days follow consistent sleep and anti-inflammatory eating, that your cognitive symptoms and your leg symptoms tend to peak and ease on the same days. That log is not anecdotal evidence. It is a 30-day data set that traces the brain-body connection in your specific body. Take it to your doctor. It reframes the entire conversation from managing a chronic condition to investigating a root cause. I want to close with this. Evelyn, the retired school teacher from Savannah, after 4 years of treating her legs, she eventually found a physician who asked the question nobody had asked, who looked at her complete picture, who ordered a cognitive assessment and an inflammatory panel alongside the standard cardiac workup. What they found was significant neuroinflammation, early hippocampal changes on imaging, and autonomic dysregulation, measurable by a simple heart rate variability test. None of those findings were in her cardiac file. None were in her kidney file. None had been looked for because nobody had thought to look. Her treatment changed that day, not because they gave her a stronger diuretic, because they finally looked in the right direction. Her swelling improved over the following months as her neuroinflammatory load was addressed, not completely, but meaningfully, enough that she stopped needing the diuretic every day. Enough that the dizziness on standing resolved. Enough that she told her daughter she felt like she was getting some of herself back. Your legs are talking. The question is whether you and your doctor are listening to what they are actually saying. The swelling is not the problem. The swelling is the message, and the message is coming from your brain. You now have 4 mechanisms that explain exactly how. You have 5 interventions that address the root rather than the symptom, and you have the questions to take into your next appointment that could change the direction of everything. If this changed how you think about what your body is telling you, please subscribe. This channel exists to show you what a rushed appointment never will. And share this with someone whose swollen legs have been treated for years without ever fully resolving. What you share today could change what happens at their next appointment. Leave a comment below. Type yes if your doctor has never connected your legs to your brain. And tell me how long you have been dealing with this. I read every single comment. This is Dr. Angela Whitfield, and I will see you in the next one.